We are here at the conference, the anniversary conference of the University for Humanistic Studies in Utrecht in January 2014. I'm very happy to be here with Professor Helen Kohlen from Germany. Could you shortly introduce yourself, please?
Yes, thank you very much you already introduced me. My name is Helen Kohlen. I'm a junior professor at the University of Fallenberg, a philosophical, theological university that is very close to Cologne and to Koblenz. And Koblenz is the city where the Rhine and the Mosel come together. Yes.
Thank you. We had already the morning session of the conference entitled A Meaningful Life in a Just Society. We had an inspiring lecture by Joan Tronto, Frans Vosman gave a lecture, and then we had a discussion. What were impressive moments or inspiring key elements this morning?
Oh, there were so many inspiring elements, but the first thing I would like to say is you always have to take history in mind. So it's of course a big difference when Joan Tronto wrote a book 20 years ago, and now she has this book on caring democracy, and being in this field for such a long time and thinking everything through. And then you have a talk by Frans Vosman, who is now thinking about practices, care practices, and bringing different approaches together. So what I'm saying is, they are very different in a way, but they come together, and this is very interesting. Because you have Joan Tronto making us alert about neoliberalism all over the world coming up and being out there, and how what kind of counter-movement, counter-story, care ethics and politics can be. And then Frans Vosman, who makes us alert about the disrupting, I would say, practices in hospitals, how they are in danger because of what is going on within realizing what neoliberalism is out there and has its effects there. Yes, I found that interesting. I'm a little bit wondering about the precarious position. He was talking about precarious position. That people are no longer there in the job for a long time, and in this context he was talking about that people do not know each other because they are going into the job, they are going away from the job, which means that this not being in interdependent professional relationships has effects on care practices. But on the other hand, my question would be, what has happened to the profession, to the way a profession is accepted as a caring profession, like a physician and a nurse? Because I think it's not a question of the position so much, because you can have a position and it can be a very powerful position, and when you have a very powerful position, it does not necessarily mean, in this powerful position, that you are interested in care practices. So, but this is something I can talk with him about. I found it interesting to get some clarification about this. But what I'm talking about, coming back to history, is what we could see is that there is a transformation in ethics. Once it was self-evident that nurses and physicians have a caring ethos. And now, over the last 20 years, people talk about autonomy. And no longer, at least in the discourse, people see and realize that there is the dependent patient with needs, and that he, of course, wants to be more independent again. But people have to take care of the autonomy of the person. And the discourse is full of autonomy, and this is not so much linked to care and care practices. And if you isolate this, people who are not in the field do not realize how much time it takes to have time to care for patients' autonomy, to bring it back. So, Yeah, and this at least is, from an historical standpoint, this is something very new.
I'm wondering, you mentioned the profession.
Yes.
We're here with a diverse group of in the audience, a diverse group of people.
Yes.
But we are talking about the theory and the research and the development of thoughts. What are your thoughts on how we can actually, well, translate that towards the profession, towards the, the educating, the teaching of the people who do care work?
Yeah, of course, this is a question. I'm a professor, I have to teach, I have to do research, and as a teacher I have to think about how I teach nurses most of all, also physicians and midwives. But the interesting thing is, you usually when you present care theories, they think it's something they do anyway. They do not see why it is so important to have a research going on care ethics. So it's very interesting to listen to them and to have case stories given by them. And to ground it in their everyday practices. And actually, the light goes on for them to realize what care ethic means and how the different dimensions become important is when they see something is missing in the care practice.
You already mentioned that history is important. It has been 20 years, more than 20 years, since Joan Toronto published her book Moral Boundaries, which was, a foundation, I think, for what care ethics is today. It's still quoted by everyone, basically, her definition of care. You actually were part of a team that brought out a new book, The Moral Boundaries We Drawn, The Significance of Joan Toronto's Argument for Political Theory, Professional Ethics and Care as a Practice. I'll hold it up for a second.
Yes, thank you very much.
And what were your experiences putting this book together? What is a significant change that has happened in the past 20 years?
Yes, first of all I want to thank my colleagues Gerd Oltius and Jorma Heyer, because we had a good time working on that book and getting to know so many interesting people who worked on that book. And to tell you the truth, the most interesting part here is that having people from all over the world together, from South Africa, from New Zealand, from Canada, from England, from France, from Holland, from Germany, hopefully I did not forget one, from the US. And to talk to them, not face to face, but riding forth and back, and getting to know what they mean when they talk about care, because for them it is self-evident in their culture, in their what they read, and then referring to Toronto. So this is methodologically it is very interesting to see how people approach care ethics, and also to see how they are brought up in their different cultures and language. Because we had to do translations, other people translation from France to English, and German English, and this very precise way of looking at words and understand what somebody means was very interesting for me. And you asked the question, what is new over the last 20 years? What in a way is new is first of all that the people coming together and try to understand each other. And also is new that people try to develop different methods when they do empirical studies to bring care ethics forward, the combination of good, solid empirical studies and ethics of care, and what kind of methods are really good. And what else is new? I think in political theory is new that people more and more contextualize the care ethics within neoliberalism and ask themselves, how can care ethics be a counter movement when the discussion of care is still within this world of neoliberalism. So this question of how can you beat out when you're already in?
Okay.
Yeah. Yes.
Okay, so sounds like an interesting book that offers many more possibilities for discussion and
Yes.
further research. Thank you so much for participating in this.
Thank you for your interest.